All right, welcome everybody. Thank you for joining us. This is our HIMSS 2021 annual State of Healthcare event. For those of you that have been a HIMSS member for a while and associated with our chapter, know that this is an event that we do every January. And back by popular demand, this is an event we did in a nearly identical format last year, with the exception of we were all in the same room physically together. I know we all missed that, and hopefully we're back to that point soon. But we had representation from both Kansas and Missouri. That's one thing that is kind of exciting about our chapter that's a little different from most of the others is we cover a metropolitan area that spans across two state lines. So those of you in the space know that it's always a lot of fun to try and keep up with the regulatory issues that vary from state to state. So this is one of my favorite events as we get the opportunity to hear from our leaders at the state level and get a chance to talk to us about upcoming policy that's coming. And of course, very timely. They're also going to provide an update that kind of touches on President-elect Joe Biden's agenda as it pertains to healthcare. And major props to our programming team of Beth and Christine as we started setting this event up some time ago. I commended them on how close they were to the actual time of the inauguration. So I don't think we could be more relevant. And as you all know, this stuff is highly dynamic, right? So as we've been working with our presenters and subject matter experts, probably no surprise, we met on Friday and they said there's more changes coming down the pipeline as new policy emerged. So we'll send you an updated slide deck on Monday. So kudos to our presenters. They worked on a holiday yesterday to actually add last minute updates. So you're getting the most real-time information that's coming down the pipeline right now. So very excited for this. So thank you all for joining us. Those of you that are on, we are also recording this, so we will share this out to everybody via our YouTube channel after the fact. So look for that by no later than tomorrow. So if you need to hop off, have more pressing matters, or couldn't join us at all, this will all be captured for you. So I'm Dave Lingerfeld. I have the honor and the privilege to serve as the Greater Kansas City HIMSS chapter president. And I am also joined and supported by a fantastic group of people. As we always say, it does take a village, and each one of these individuals you see here all play incredibly vital roles in what we do here to pull off these events. And I would be remiss in not thanking them as I always do, but especially this in our current climate for the last, roughly 10 months, these individuals have worked tirelessly under changing dynamics to do the best that they possibly can with the resources we have to try and continue to move forward with programming and share events out to our population. And it's certainly come with its struggles and its growing pains, but this group of individuals has just done a phenomenal job of adapting to that, working with new technologies to reach our membership. And I'm just proud to work with each one of these people as we've done some fantastic stuff. And but that being said, while they've done a phenomenal job, we do still look forward to that opportunity when we all get to be in the same room again and presenting live for all of you. So the main attraction for our event today is we are joined by Chad Austin, President and CEO of the Kansas Hospital Association, and also Herb Kuhn, the President and CEO of the Missouri Hospital Association. So two very intelligent individuals in the know with what's going on at the state level. And it's just been a lot of fun just getting to talk to them as we've prepared for this event. And really looking forward to hearing what they have to share with us. Just a couple real quick housekeeping items, and then we're going to get to the main event, which is what you're really here for, is to hear these two gentlemen speak. At the end of the event, you'll get a notification for a very, very brief survey. I am maniacal about surveys that go too long, so I simply want you to respond to 3 questions. That's it. Give us some information on how we did, what we could do better, and gives you an opportunity to give us any commentary on future topics you might like to hear about. We review each one of these, and this gives us a lot of insight on what our membership wants to hear from us. So please just promise it'll take you 2 minutes to fill that out. And then also don't forget to visit our website where we'll share information on upcoming events and various things going on. So with that, I'm going to change slides and I'm going to get to our speakers here. Okay, gentlemen, I'm going to turn it over to you. And just when you're ready for me to advance the slides, just let me know. But I'll let you guys take it away.
Dave, thanks. It's Herb Kuhn with the Missouri Hospital Association, and I appreciate once again the kind invitation to you and the HIMSS chapter there in Kansas City for inviting myself and Chad to be part of this program. It's one I've done several years in a row here and thoroughly enjoy it. And as Dave indicated at the outset, it's too bad we all can't be together, but I really appreciate this opportunity to come together with you all virtually. So as you can see from our first slide here, here's our title. And look at that title for a second. President-elect Biden's anticipated health agenda, the expected and the wild cards, and Kansas and Missouri issues. I can't think of a more complicated title that I've ever put together in a presentation than this one. I mean, it almost sounds like it's an academic paper and that someone is writing their PhD about all this stuff out there. But I think in that title sets the stage for us because it really kind of sums up the volume of information that we've all had to process in this past year, and particularly at this critical time. As Dave laid out, we can't imagine a presentation today, which is the final full day of the Trump administration, and tomorrow is the first day of the new Biden administration. So trying to bridge that gap, Chad and I are going to do our very best to try to do that. But as we all know, things are changing so rapidly in this country, so rapidly at state governments, at the federal government, that everything we share today could be very different on Thursday. But I think we've got a pretty good line of sight on some things. So hopefully some of our things that we share today, some of our projections are spot on. So we'll see. But Dave, I'm going to ask you to kick it to the next slide and let me turn the next few over to Chad to walk you through what we plan to try to talk about today.
Thanks, Herb. And again, thanks everyone for allowing me the opportunity to provide some insight in terms of what's been happening, at least in Kansas, and what we're observing happening on the federal level. As Herb mentioned, this is really an unprecedented time in terms of all the activities going on. Not only do we have the pandemic going on, we also have our state legislative session starting up, and then we also have all the changes that are happening on the federal level. So lots of activities that we're hopeful that we'll be able to kind of share some insight in terms of what we're dealing with, not only on the state level, but also on the federal level. And so to get started, what we really wanted to kind of do is to break it into 4 different categories, specifically looking at President-elect Biden's anticipated health agenda and walking through what we anticipate coming up from what we've been seeing through different reports from him, as well as from other folks that are close to the Biden administration. In addition, the COVID-19 response activities, not only from Kansas, but also from Missouri, how the hospital associations are engaging, what's the latest related to what our states are doing as it pertains to vaccine distribution, testing, PPE, all the above in terms of those activities, and then really take a little bit more of a deeper dive into what's really happening from a Kansas perspective and a Missouri perspective, highlighting what we anticipate could be coming up in the upcoming legislative sessions. David, I'd have you move on to the next 2 slides if possible, please. So when we're looking at President Biden's agenda, really, as Herb mentioned, we're in one administration today, and tomorrow it's going to be drastically different than what we have been seeing. And so under the new administration, we do see that there's going to be some different approaches as we're looking at the COVID-19 response, both from a clinical and an economic perspective. And already we've seen that President-elect Biden has indicated that he would like to see a COVID-5 package. And so that's something that's near and dear that we're paying very close attention to. In addition, the Medicaid and the Medicare program, looking at the emergency orders that may be, or executive orders that could be coming out here in the next few days by the Biden administration, breaking it down into commercial and private pay impacts and what's happening with that, and then really kind of taking a view of the wild cards that we anticipate could be part of the discussions as we look at not only the short-term Biden administration, but also more of the long-term anticipation of what issues could be coming up, and then having a little bit more of a discussion on the Biden healthcare team as well. So I'm going to toss it back over to Herb to talk about the next slide or 2.
Thanks, Chad. And so on this one, it's kind of a busy slide, but I think it's worth kind of just reflecting for a minute as we try to build context of what we might see initially in the first few weeks, but also down the road. So when we first put together this slide deck, that top dot point or that top bullet, we had maybe Georgia being split. All the people, all the experts were saying that Georgia would split, and guess what happened? On the January 5th, Both of those seats went Democratic. We have a 50-50 tie in the U.S. Senate. The Vice President, Kamala Harris, will be the tiebreaker on that as we move forward. And so what we see going into this new year with a new administration is the smallest of margins, a virtual tie in the U.S. Senate and a very small margin in the House. That will play a big thing and important as we go forward. But there's an interesting wild card here to think about. So everybody talks about Mitch McConnell from Kentucky. Currently, he's the leader of the Senate. Beginning tomorrow, he will not be the leader in the Senate. He will be in the minority party. But when Joe Biden's son, Beau Biden, passed away here 5 or 6 years ago, Mitch McConnell was the only Republican senator to attend the funeral. So there is a relationship between those two men that I think is important that we shouldn't lose. Now, will that translate over into their ability to work together in the future? We don't know, but it's a good and hopeful sign. And believe me, we're all looking for hope right now as we move forward. We know we'll be in the second full month of Operation Warp Speed, and we'll talk a little bit more about, in more detail about vaccinations and that work in a little bit. The other thing that's important out there is on Team Biden and their ability to get their nominees confirmed that's out there. And there's been a lot of noise about this. But I think it's important to know that notwithstanding the fact that on day one, he won't have any of his cabinet members yet confirmed by the U.S. Senate, he has probably put more people in the White House than any other prior president. And so my guess is, and what a lot of us see, is that a lot of this will be kind of a centralized management of this new administration with a lot of the decision-making coming out of the White House. And he's going to have that team loaded up and ready to go. So the fact that he won't have a lot of folks confirmed, it is a concern, but it shouldn't be that big a problem. And then the final one I'll observe, and then I'll turn it over to Chad to see if he has anything to add here, is the fact that Biden has been very careful of putting together his administration. He owed a lot of groups, a lot of different minority ethnic groups and different voting blocks around the country. And he put together his cabinet. I think he did a very, very effective job of making sure that he crossed all those T's, dotted all those I's. So he won't have that challenge going in initially. It may emerge in the future in terms of different groups pushing him. But in terms of whether it's progressives, the more conservative side of his party, whether it's the Black Caucus, other groups, he seems to have allayed a lot of those concerns. So that, again, gives us hope that he's done a really good job and has his good finger on the pulse of what's going on. Chad, anything to add about this one?
Just the only thing I would mention, Herb, and you kind of hit upon it in the first bullet point, is that now that we have a split Senate, some of the folks that we've been accustomed to, at least in Kansas, and probably you in Missouri, as well as our state senators, where in Kansas we have 2 Republican state senators, where they will now move from being in the majority party to the minority party. And so that does have some implications and possibly some of the ability to for us to be able to utilize them to be more persuasive with the administration. And so that will be something that we'll have to kind of see how that plays out. In Kansas, out of the 6 congressional members that we only have 1 Democrat, who is Sharice Davids, obviously in the Kansas City metropolitan area. And so she will become more front and center in terms of some of our communications that we have as we're dealing with politics within the administration. One of the other items related to it, and Herb, you would know as well as anyone in terms of how they're going to manage some of the committees now that you have a split chamber, where it sounds like in the committees, they'll have the same number of Republicans as well as Democrats, but the Democrats will be the ones determining what will be the topic of the day that will be discussed in those committee meetings. But will be something we'll need to be paying close attention to.
So Dave, let's go to the next slide, please. So let's talk about wild cards, and think about a new administration coming in with that many different wild cards sitting on your plate, whether it's an uneven economic recovery, potential for political gridlock, continued civil unrest, Operation Warp Speed pitfalls, potentially the mutation that we're starting to see with the COVID-19, and just the foreign policy challenges. It goes on and on and on. But I think we wanted to kind of key on a couple of healthcare issues. One is in the upper right-hand corner, the Medicare Part A solvency. I want to chat a little bit about it. But let's talk about the Supreme Court and the ACA ruling. And Chad, why don't you take that one first, and then I'll chime in on about Medicare.
Sure. So that's one of the items that we've been paying very close attention to. from a Kansas perspective, looking at the Supreme Court oral arguments that they had previously on the ACA ruling. What we're doing right now is waiting for those results to come out in terms of whether or not there's going to be any action from the Supreme Court related to the ruling. There could be, obviously, every sign that we've been seeing thus far is that there wouldn't be a complete outright rejection of the ACA, but there could be some alterations. And so really kind of paying very close attention to see how that's going to play out and what implications there could be under the new administration. And then what is the reaction for the current administration or the upcoming administration as to how to react to whatever Supreme Court ruling may come out from the ACA.
So on the Medicare Part A solvency, as we know, Medicare Part A is a trust fund. And over the decades, they've talked about solvency. The Medicare trustees always put out a timeline of when it might go insolvent. The current projection is 2024. Guess what happens in 2024? It's another presidential election year. So talk about an impending kind of crisis or issue that could be coming up out there in the future. And so it raises all kinds of issues that everybody needs to think about in terms of Medicare. One is the baby boomers. I'm one. Those of us born between 1946 and 1964, we started aging into the Medicare program in the year 2009 and will continue until 2029. That is changing dramatically the Medicare program. We went from about a decade ago of about 50 million people in Medicare now to 80 million. So it is a big sea change, and this insolvency issue is going to be a huge issue. But also it's going to impact some things we'll talk about, Chad and I are going to talk about a little bit more. And does that really get in the way of the progressives movement of Medicare for all? How does it deal with new Medicare benefits that people are after, particularly long-term care benefits? And could it impact, as I mentioned before, the next presidential election? So some big wild cards out there everybody needs to be paying attention to. So let's go to the next slide, please. So day one, that's tomorrow. So what are we going to see? So when Chad and I put together this slide deck, we went with the best information that we could come up with. And that was, dealing with this Mexico City executive order, which is dealing with some abortion related issues. One thing that we suspect the new president will do is suspend a lot of the administration's prior executive orders or regulations that didn't come in within that final 60-day window so that they get a clean start, rejoin the World Health Organization, deal with DACA, and deal with the COVID stuff. But what we do know is the incoming president's chief of staff, Ron Klain, happened to send out a memo a couple of days ago that kind of laid out what everybody could expect not only on day one, but the first 10 days of the new administration. But on day one, inauguration day, they've indicated that he's probably going to sign about a dozen executive orders. And he's going to first deal with education. He's going to probably pause student loan payments and try to create a forgiveness issue there. He's going to rejoin the Paris Agreement to deal with global warming. We're probably going to see a little bit about a 100-day mask challenge that is on federal property and interstate travel. He's probably going to look at the issue of evictions and foreclosures of people who have or in homes so that he can kind of stem that crisis. And then they've kind of indicated during this first 10 days is that they'll probably go the next day on Thursday is when we'll see a lot of the COVID rollout. And Chad and I'll talk a little bit more about that. But Chad, anything else you want to talk about day one or anything you want to add to that one?
I don't think so, Herb. I think you covered it well. Thanks.
Okay, let's go to the next slide, please. So let's tee up what we know about the Biden team. As we indicated, he's going to have a lot of folks he needs to get appointed into the administration. Within HHS, there'll be about a dozen people, and we don't know a lot of them yet. But what we do know, obviously, is we'll start with Kamala Harris, his vice president. And the reason I start with Kamala Harris is Chad and I have a wonderful colleague out in California who we've chatted with and asked her about what the new vice president has been about in terms of healthcare because she was attorney general in the state. And one of the things that she was very passionate about it was maternal mortality. And folks might remember a few years ago, USA Today did a pretty big expose about maternal mortality across this country and the real challenges that we have. Since then, most states have engaged in that issue pretty aggressively. Um, the vice president-elect was very involved out in California, and that could very well be one of her major agenda items as we move forward. The other thing she's been very involved in is health equity. And we know the disparity issues that we have out here. And I think if anything, COVID-19 has really amplified those. So we might see some more work in that area. And then hospital consolidation. As Attorney General, she was very hard on the hospital field and in terms of consolidation issues, and whether that translates into work that she might be involved in as vice president, we don't know, but that's kind of her legacy out in California. Other new administration folks are Xavier Becerra, as Secretary of HHS, former member of Congress, moved home to California, is currently Attorney General, and will be moving into confirmation. At the White House, the coordinator for COVID response is Jeff Zients. He was in the Obama administration, part of the National Economic Council. He was OMB, and he worked for a while at the advisory board. And then finally, over at Director of CDC is Rochelle Walensky. Dr. Walensky is an infectious disease physician, medical training at Johns Hopkins, and actually did her undergraduate at WashU over in St. Louis. And her position is unique and it's different in that she does not have to go through confirmation because CDC does not generate any policy issues. What she really works on is just implementation of public health issues. So it's going to be a real opportunity for her to get started tomorrow in the new job. What we don't know is some of the other folks. We don't know who's going to be running ONC, which will be an important group for you all. We don't know yet who's going to be running CMS. We think we've heard who might be running HRSA and some other folks' rumors, but it remains to be seen. And I know one of the key issues that's important for Kansas is, and like Missouri, but I think Kansas has provided incredible national leadership in the area of rural health. And I imagine, Chad, you guys are going to be looking closely as these additional people are announced and what they do on rural health. And any observations you want to make about that?
No, you're right on that. And that's one of the items we'll be focused on in terms of the relationships that we have with our federal partners on some of the rural health activities. And I saw just today that the President-elect Biden came out and nominated Pennsylvania Health Secretary Rachel Levine for the Assistant Secretary of Health at HHS. And so, as you mentioned, Herb, you know, the administration's starting to kind of fill out as much as they can some of the nominations that will be going through the Senate confirmation process. And so, as we continue to see who comes into those positions, will be an item that we'll be reaching out to get a little bit deeper dive into their backgrounds and to see how they may approach healthcare, whether it's urban healthcare, rural healthcare, with some of their policy decisions.
Next slide, please. So leaning forward a little bit in terms of the new administration is an announcement they made last Thursday. And they called it the American Rescue Plan to fund vaccinations, provide immediate direct relief to working families, and supporting struggling communities. And as you can see, there's 3 dot points on this slide, but let me kind of go a little bit of a deeper dive, Chad and I, to talk a little bit about this. So the first one is the effort to mount a national vaccination program. And as we said, we think we're going to hear this announcement on Thursday, but there's basically 6 big themes that we expect to see, which is very different from what we've seen in the current administration. First one is 100 million doses in the first 100 days in the arms of citizens across this country. And just to give you a sense of the order of magnitude, think of Missouri for a second. We've got a population of about 6 million people, so we're about 2% of the total US population. For us to hit that target, we would need to vaccinate 20,000 people a day, or about 140,000 a week. That's probably 3 times the level of what we're currently vaccinating in Missouri. So it would be a huge uptake. So 100 million doses first 100 days. Second thing we're going to see is mass vaccination clinics. A lot of great work by hospitals, physician offices, FQHCs, local public health agencies, many others involved in the vaccination game. But is it enough to get us to the level where we need to get herd immunity around this country? And so they'll enlist the FEMA, the National Guard, to begin really trying to put together these vast vaccination clinics all across the country. And we're going to see our first one in the state of Missouri this Saturday down in Poplar Bluff. So an early glimpse of what that might look like. Third thing they're going to do is allow more organizations to access vaccine, particularly FQHCs and others. So again, get more vaccinators out there. Fourth, they're going to use the Defense Production Act to produce more vaccine supplies. If you remember, the Trump administration used Defense Production Act to really work in terms of testing and ventilators. So we're going to see more activity there. Fifth, they're going to probably sign the executive order. I talked about this a little bit more about the 100-day masking, but we're probably going to see more executive orders dealing with keeping schools open, expand testing, things like that. And then finally, the sixth thing we'll probably see in this big announcement is to launch a national vaccine education program. So a lot of lift in that per The other two things I would just mention briefly on immediate relief for families. We've heard about the talk about $1,400 checks per household, more housing assistance, more child care assistance. And then on the last one, more small business support and support for essential workers. So very different. And I don't know, Chad, anything in terms of the contrast of what we might be seeing here?
I think you identified those items there, Herb. And one of the things you mentioned, the state of Missouri is about, what did you say, the 2% of the population's in Missouri. You know, Kansas is typically 1%. And so about half of what you just mentioned. And so I do think that that's going to be a fairly significant challenge within our state. And we're working with our State Department to determine how they're planning on moving forward with the different phases. And I know both you and I will be talking about vaccine distribution later on in the presentation as well.
So let me turn it back to Chad and walk us through the next couple slides.
Thanks. Just a couple things just want to kind of visit about as we're talking about vaccines and vaccinations. That's been really the main topic of discussion. I know, at least in Kansas, with many of our hospitals over the course of the last, several weeks, if not the last couple of months, in terms of making sure that we're prepared for the vaccines to be rolling out. One of the items, just to kind of share with you, and I think one of the challenges that we typically have faced is getting the public to support vaccinations. And what are some of the trends? What should be some of the expectations? As we have been rolling out vaccines within some of our hospitals, what we've been seeing is about 85 to 90% of the physicians have been taking the vaccines. And then when you look at non-clinical individuals, it's about 50 to 70% have been taking the vaccines. When you look at this slide here, looking at flu vaccinations, it's really interesting to see that for the average, the vaccination rate hasn't been higher really than 48.5% of the total population. And so just to get vaccines on flu, which has been around for quite a long time, there's already some challenges with that, let alone trying to move forward with this COVID vaccine. On the next slide, it gives a little bit more information related to what we're looking at from state to state. And you can kind of see on this grid where Kansas falls, as well as Missouri, as well as the United States. The United States average for flu vaccinations about 48.5%. When you look at Kansas, it's a little bit slightly better at 50.9% of the population. And when you look at Missouri, it's just a little bit less than what the US average is, where it's roughly, I believe, let's see, it's about 47.5%, I believe, if I'm looking at this slide correctly. So it is something I think we're going to be spending some significant time on from our perspective, trying to educate the public to get the public support and the understanding of the need for the COVID vaccination. I don't know, Herb, any other insights that you may have from a flu vaccine coverage?
No, I think you covered it very well. Thanks.
Okay.
Why don't you go ahead and lead this one off too, Chad?
Well, just one of the political slides that we wanted to share with you. And I think we're seeing this, not only within the federal national level, but also at least here in Kansas as well, where, in essence, you're kind of really trying to figure out what are the polarizations that are happening. And in essence, what we're seeing is that when you look at the left side of the party, it's getting even more outspoken, as well as the right side of the party. And so quite candidly, the more of the middle population in terms of the politics is becoming less vocal or less available in terms of trying to really steer the country. And I know that's something that President-elect Biden is going to be trying to talk about, which is uniting the public to come together. But I do think that that's going to be one of the key focal points that we'll need to be watching for, and hopefully he'll be able to come through in terms of trying to unite the general populace.
You know, and one other quick thing I would just, since you can't do a presentation without at least one cartoon political slide that's out, is the other thing that's going to be interesting to watch as this all plays out. If you think about what's happening in terms of the COVID crisis, the pandemic so far, is it's made a lot of people TV stars, and no less than a couple governors across the country. Particularly, I'm thinking the governor of New York and the governor of California on the TV very regularly talking about this issue that's out there. As this now transitions to DC and Washington starts to have a larger role, their role, their vision, what they're doing out there it's still important, but will they still be the center of attention out there? So you have this left and right, but also some internal politics that might play out. And will the governors embrace this? And what do they see their role going forward? Does it diminish their role? Does it enhance it? Something we all have to keep an eye on as we go forward. So next slide, please. So let's talk about Medicare and Medicaid a little bit. And all the things that are going on with Medicare and Medicaid talked about during the presidential election. Certainly, President-elect Biden has done had a lot of conversations on a lot of these issues. But the first one is on the right-hand side, and to incent the 12 states to expand Medicaid. Missouri, as folks know, adopted Medicaid expansion in a ballot initiative next year, and I'll talk about that more when we get to Kansas or Missouri issues because we need to implement this year. But Chad, you want to talk a little bit about the Medicaid expansion and this possible incentive and what it might do for a state like Kansas, because you're one of the 12 still out there?
All right. Yeah, thanks, Herb. And, that is something that, as we've seen with this new incoming administration, as we pointed out with the U.S. Senate being split, that there could be a possibility of looking at some more flexibilities that relates to Medicaid expansion. And so one of the items that we've been picking up as we've been talking with our congressional delegation members, as well as with our national partners, is that there could be some possibilities on providing some more incentives to those 12 states that have not yet expanded. One thought process related to that is to go back, if you recall, early on in the expansion discussions, when those initial states expanded, those initial states received 3 years of 100% federal funding for the Medicaid expansion population. That has gradually decreased over the years to where now it's 90% federal funded, 10% state funded. But there's been some discussions as to would that entice some of those remaining states to come on board. That's something that we're taking a look at. I think when you look at the dynamics, and I'll talk more specifically about the legislative makeup in Kansas, I'm not quite certain that would be the straw that would allow us to or the tipping point for our state to move forward. But I do think, as we look at the surrounding states, now that the state of Missouri has passed it by a ballot initiative, Oklahoma has passed it by a ballot initiative, Nebraska has passed it by a ballot initiative, Colorado has been one of the early adopters with expansion. Kansas doesn't have the capabilities of doing a ballot initiative, and so we have to go through the traditional process of getting legislation passed through our state chambers and then signed by the governor. We are looking at what flexibilities could be brought forth, and whether it's the 100% federal funded for the first 3 years, or looking at a partial expansion that states like Georgia, Utah, and others have talked about as to expanding Medicaid only up to 100%. There could be some possibilities for some states to bring innovative, creative ideas to the Biden administration to talk with them about Medicaid expansion.
Yeah, Kansas really found itself as an island when Missouri took that action next year. So I think this is a very important issue and for all of us, and might help us in our implementation, but very important for Kansas. Just a couple of other observations about this slide. I talked earlier about the issue of the trust fund and the importance of that. But if you think about the public option, the Medicare early buy-in will all be things that will be impacted and drive additional Medicare costs. How can they deal with those policies, let alone deal with Medicare for all, which will continue to be background noise as we go forward. Another important issue is right there in the center at the bottom, social determinants of health, and a growing and important issue that's out there. And I think particularly for the data geeks, this will be a very important issue to help drive, I think, some health care policy to collect information that could be very impactful as we go forward. So just a lot to happen in the Medicare and Medicaid space on so many different fronts and policy that will involve a lot of data elements and the field that most of you find yourself in. So an important aspect of that. Next slide, please. So this one is kind of pivoting a little bit to the private sector a little bit. And I think what we're trying to kind of telegraph here is a couple of things. One is, the support of transparency, telehealth, value-based care will continue to move forward in an aggressive way. A lot of waivers were put in place to help support the pandemic. Many of those now may become permanent, such as telehealth and things, when those will be important things for us to all look at. Some other important issues I think will move forward down there, and particularly in terms of program integrity efforts. If you think about very hard that if, again, we're getting into an era of when the trust fund is going to go belly up in about 4 years, it will raise once again the specter of how much are they doing to make sure that there's no fraud, abuse, and waste in the system. And so program integrity, I think, over the next few years will come back in very strong ways so they can totally inoculate themselves on those issues that are out there. That's a good thing. As taxpayers, we want to make sure that that works well. But how they put together the program integrity issues, the kind of new data requirements they put on healthcare providers will be really essential and key to make sure that they don't overreach and create some challenges. Chad, anything you want to observe on this particular slide?
No, the only other comment, I think you hit upon it, but obviously the telehealth component is something that we're paying very close attention to, and then just the administrative burdens that are out there, whether we're talking about public payers or in this case more commercial private payers, is something that we're very sensitive to as our hospitals are trying to be able to operate on a day-to-day basis.
Okay, let's jump to the next slide, please. And how about the next one? So what we're going to do is we're going to talk a little bit about the COVID response now. And then when we get done with that one, I think, Dave, we're going to take a quick break. And then we'll come back and finish up the Kansas specific issues as we go forward. So let's bump to the next slide, please. So if you look at the COVID-19 and the pandemic response, the early focus, you can see those issues there: the hospital capacity, the PPE, financial stability, testing, et cetera. The current focus is now all about vaccination, all about public awareness, staffing, and again, financial stability. But if you think about the pandemic, it's been a story of shortages. So when the pandemic first started, everybody remembers in March and April, it was all about PPE. There was not enough personal protective equipment anywhere. People were trying to sell it on eBay and all across at outrageous prices. It was chaos. Manufacturing picked up in this country and we were able to kind of deal with that. We then moved to the next shortage, and that was testing. And the problem of getting testing, and how could we really begin to mitigate the surge if we really didn't know who was infectious? How did we isolate them? How did we do contact tracing? And so a lot of effort went into testing. The next big shortage was in staffing, particularly when we saw surges largely in October and April, some in the early stages in parts of the country, but here in the Midwest, it was kind of July and then October, November. And then we're seeing it start to level out a little bit now, but it was all about, did we have enough staff? Because generally when we have staffing issues, it's within a state. Now it was a national marketplace for staff, and there was just huge shortages out there. And then finally, now the shortage is vaccinations and vaccines that are out there. So it's been a story of shortages, and as we've all tried to play catch up as we move forward. So Chad, anything to add to this one?
No, I would say that, our experience has been very similar to what you've articulated, Herb, in terms of Missouri and kind of the focus points. Each one of those items are big topic items that we've had conversations about. And as we've talked about here recently, really the current focus of the vaccine distributions within our state, trying to move to phase 2. And we'll talk about that here in a little bit. The staffing is something that we continue to hear from our hospitals throughout the state, not only because of getting staff to be able to provide more care to the number of COVID patients that are coming in, but also at the same point in time, we've had staff that have gone on quarantine. And in addition, we have staff that have young children who, quite candidly, when schools are starting to dial back or become more remote, it's more challenging on those families to be able to find childcare for those individuals who have young children. And so staffing's been a significant item that we've been focused on here recently. And then throughout this whole process, just the financial stability. And I think one item just to kind of mention or related to that, that you may be hearing from your members as well, is that, while we did receive significant federal funds early on in the pandemic, and there's been opportunities to get more funds through this most recent COVID forward package that's out there, it's the rules of the game is what we're hearing from our hospitals, that they may have some additional funding that came through from the federal support, but making sure we know how those rules are going to not only be set up now, but as we move forward as well, because there's been one too many times we believe that we think we're abiding by one set of criteria, and then little do we know that a month from now, 2 months from now, the criteria has changed and it's retroactive in terms of when we receive those funds. And so that's something that we continue to kind of spend a considerable amount of focus and energy on.
Yeah, great points. Next slide, please. So the vaccine strategy. This is kind of our view of what things have looked like. Operation Warp Speed. Who would have thought that we could have a vaccine now in less than a year? The clinical work, the research, the regulatory review to get us that in less than a year is just astounding. These vaccines take 3 to 5 years, if not longer. It's a miracle. I don't think there's any way you can put it. And the fact that early on in the conversation were two big questions about the vaccine. What's the level of immunity we could get from a vaccine, and what's the durability? We know the immunity question, it's 95%. Many people were just saying, let's get better than 50%, then we would be successful. But they hit 95%, which is just beyond belief. And then the durability. This is not going to be like the measles, where you get that vaccination once and you're good for a lifetime. Or it's probably not going to be like the flu, where you have to go in and get vaccinated every year. But can we get 2-3 years out of this vaccine before this virus mutates and we've got to get another one? It's going to be here for the rest of our lives. But what happened then is, without the federal leadership, as they moved to allocation, as they moved to distribution, it became chaotic. And I think that has slowed some things down. There's been multiple signals that people have received. I know as we work with our state officials, they can hear 4 different answers from the federal government on a given day in terms of things that they ought to be doing. So it's been extraordinarily difficult at the state levels to implement this. And I think people are looking forward to next Thursday, or this coming Thursday, to what new direction might be. So Chad, why don't you, any additional observations on this one, and then take it in to talk a little bit of the vaccine effort in Kansas?
Yeah, we can go ahead and move on to the next slide, Dave. So just wanted to kind of share a little bit of activities related to what's been happening in Kansas from a COVID-19 vaccine distribution. And so early on, from our perspective, this was something that we identified working with the state of Kansas on what do we need to be doing in order to be able to ensure that our hospitals are prepared to receive the vaccines. And so fortunately, we were able to work with the Kansas Department of Health and Environment, which is our lead agency here in Kansas, to conduct a survey of the KHA membership that we sent out, and specifically asked them how many frontline workers do they have that would need vaccines from their perspective, and would they be willing to vaccinate not only their staff, but would they be willing to vaccinate folks within the community as well. That survey response that came out in October was really the premise in terms of trying to start the allocation process for the state of Kansas. We looked at not only those items, but we also need to focus on storage capacity. We all know that with the Pfizer vaccine, when that originally came out, you had to have ultra cold storage. Well, not every hospital within our state had ultra cold storage, and only a handful of hospitals did. And so could we identify those and use those as basically the hub locations, and then spoke out to outlying areas to be able to help transfer some of those vaccines out throughout the state of Kansas. We also made it a priority within Kansas that at the very beginning of the onset, that when the Pfizer vaccine was going to become available, that it was the intention that every hospital should receive some amount of the Pfizer vaccine. And so we made it clear from our association to the state to be able to make sure that they put together a plan that nearly all 122 of our Kansas hospitals would receive an initial allotment of the Pfizer vaccine. What's really amazing, I think, from our perspective, and I think Herb may agree with this as well, is that on the federal level, the federal government approved the Pfizer vaccine on a Friday, and by that Monday, we were getting vaccines to our hospitals who are already starting to vaccinate their frontline employees. And so really just an amazing feat when you think about how quickly that process went from the very beginning. If you look at the next slide, Dave, if we move on, one of the items I would just kind of share is that when that vaccine started becoming available to our hospitals, the amount of emotional response and the appreciation that our hospitals received was astronomical. We actually started receiving lots of communications, lots of pictures of our hospitals receiving that vaccine and just the emotional relief that was happening within our facilities. It was something that I think at the very beginning, we've been running a sprint with the COVID pandemic since last March. And to think that maybe there's a light at the end of the tunnel with that vaccine really was an emotional relief for many of our hospitals, that the end may now be in sight as we move through this process. On the next slide, just to kind of share more specifically, we talk a little bit more about the phases. And this is something that every state does a different process in terms of what their phases are. And some states, it's more of a 1A, 1B category. What our state decided to do was to do phases 1, 2, 3, 4, and 5. Where we're at currently is in phase 1. And phase 1 is frontline healthcare workers, residents or patients in long-term care facilities, and then those workers critical to the pandemic response continuity. We have not yet gone to phase 2. In fact, right before this presentation, we were on a call with KDHE Secretary Lee Norman talking about when we may be moving to phase 2, and he indicated that it could be imminent in the coming days, if not in the next week, that we may be looking at moving into phase 2. Phase 2 is going to take a lot more complications, I think, from our perspective in terms of making sure that we have a process put in place. It's one thing to reach out to the hospitals and distribute the vaccines to the hospitals to be able to vaccinate their staff, but how do we do this in a coordinated fashion for individuals over the age of 65, for the congregate settings, for high contact critical workers, and then for any of those vaccinations that we need to do for those that remain in the first phase. And I think that's going to be where it's going to take an all-out effort of not only hospitals, but the local health departments, the safety net clinics, the local pharmacists, to be able to coordinate this so that we can get as many people vaccinated as possible. On the next slide, we're talking a little bit more specifically about some of the continued considerations in terms of, as I just mentioned, the logistics, looking to make sure that we have adequate supply of syringes. And I know Herb mentioned that previously, that that's been a focal point of our federal government, making sure that we have sufficient PPE. But what we have seen, ironically, is that when we received the initial dose of Pfizer vaccine, there was one type of syringe that came that we were able to pull 6 to possibly 7 doses out of each vial. Then when the second allotment of Pfizer came out, we had a different type of syringe that we were having some issues, or at least some of our hospitals were having issues pulling that 6 and possibly 7th dose out. So making sure that we have an adequate supply and we know what supply of syringes are going to be coming in. And then also, again, going back and talking more specifically about the public skepticism, I do think that we're going to have more of a concerted effort as we not only talk about our healthcare workers becoming vaccinated, but making sure that there is some understanding and comfort level from our general public on the vaccine and the efficacy of the vaccine and the safety of the vaccine. And that's going to be something, I think it's going to be an all-out effort that's going to happen, not only from a healthcare provider perspective, who are seen as the credible sources for any type of healthcare information, but also other partners as well as we move forward with that. If you move on to the next slide, I'll toss it over to Herb, who can talk a little bit more specifically about the vaccine launch in Missouri and how that's played out as well. Well, Herb, you're on mute. Oh.
Thanks, I muted myself, appreciate that. So the first vaccine was administered in Missouri on December 14th. So one way you could look at it is it's 1 down, 12 million to go. Because as we know, this is a 2-shot regimen and there's 6.1 million people in the state of Missouri. But the vaccine's interesting. It's not authorized for the current 2 vaccines. They're not authorized for people under age 16 and 18 respectively. So assuming in Missouri, we want to hit 70% of the population to achieve herd immunity. That's 4.3 million Missourians that need to be vaccinated. That's 9 out of 10 adults over the age of 18. So that gives you a sense of kind of the order of magnitude of what we're dealing with. And another way to look at it, instead of 1 down and 12 million to go, it's 1 down and 8.6 million to go. So it's a lot of vaccinations that have to go forward. So when Missouri, like all the other states, put forward its plan, we did a tabletop exercise on December 3rd, and it went exceptionally well. Very proud of the state and all the people that participated in that. And then, of course, reality sets in. And one of the first things that we found is that the enrollment system into our Show Me Vac system was having some challenges. The state recognized that immediately, moved the National Guard in to help facilitate that. And now we've got over 1,000 vaccinators enrolled in the state of Missouri. They moved quickly. I really applaud the state what they did there. Also, there was an audible call that was made early on in the process. We were in phase 1A at the time, and that was basically healthcare workers and long-term care, both the workers and residents of long-term care facilities. As Chad was saying, the Pfizer vaccine, you have to have ultra cold storage. And so that was largely going to be in the urban areas where you had those facilities. For the rural areas, in particular the rural hospitals, we're going to get the Moderna vaccine. But the state made that audible call on January 17 and said, no, we're going to pull all that to long-term care facilities. And so it put some rural hospitals a little bit further behind in terms of being in the line to get their vaccinations that were out there. But working with some redistribution, we're moving through those groups and catching up pretty quickly here. So next slide, please. A little bit dated, but on January 13, you can see the stats in Missouri in terms of the level of vaccination. We're a little over 200,000 total doses been administered today. But remember when I talked about if President Biden launches that 100 million vaccinations in 100 days, that's about 140,000 a week in Missouri. This is what we've done in the first month. So it gives you a sense of the effort that needs to go forward to make this happen. Next slide. So Missouri pivoted last Thursday. That's when we began to move from the phase 1A, which again was healthcare workers and long-term care, into phase 1B. And the governor laid it out in 3 tiers. Tier 1 was launched last Thursday, Tier 2 was launched yesterday, and Tier 3 is yet coming. If you look at all the population in those 3 tiers, it's about 2.5 million people. So we jumped from a finite crowd of healthcare workers, people in long-term care facilities, of 500,000, now to 2.5 million effort. It's going to really take an effort to move forward here. Next slide, please. So this one just looks at some polling that we released a week ago yesterday. We really were interested in kind of, as we begin to move forward, how do we target the people to be vaccinated and how do we target our educational efforts? So we went in the field and did a poll of 800 people across the state, adults across the state, in terms of their interest and willingness to be vaccinated, because it gave us hopefully some good benchmark information. And the numbers were concerning. What we found is that the likelihood of getting vaccinated, about 58% of the people that were either very likely or somewhat likely. But the folks that were not too crazy about vaccination was about 38%, those that not too likely or not likely at all. So we have some real disparities in terms of vaccination. And think about those charts that Chad showed you earlier in terms of the flu vaccination. That might have been a good precursor to what people are thinking about this one. Then we talked to the adults across the state about their confidence that vaccine distribution would be fair. And 7 in 10 people in the state actually were somewhat confident that would be fairly distributed. But those that were skeptical tend to be more were African Americans, and quite the reverse we saw in terms of vaccination. What we saw, people who identified as Democrats and those who identified as either Republican or conservative. Democrats were more likely to be vaccinated, the others less so. In terms of the fairness of distribution, Democrats were more skeptical it would be fair. Republicans were more, thought it would be a fair distribution. Then we asked folks about their personal vaccination plan. And what we found is that older adults, which is good because the target audience early for us is those over age 65, and especially men, were ready to step forward and get vaccinated. So that felt good. And then we did some geography work. And what we found is that, particularly in the St. Louis and in the Springfield area of the state, we have a lot of work to do in terms of vaccination that's out there. Next slide, please. And this one just talks a little bit about partnerships. This was a news release that was released late last week with us and the Missouri Chamber of Commerce about working together to do education with businesses to help them find vaccination sites, hospitals working with them to move forward. It's going to take all kinds of partnerships if we're going to make this happen. And this is just one example. And you're going to see many, many more as we move forward. And it's important that we're able to kind of execute on those. So Chad, let me let you talk about the education effort in Kansas.
Sure, thanks, Herb. Just to kind of now transition a little bit more on a couple other things that are going on. We talked about vaccines, but also the testing aspect. And that's something that's been a top of mind issue that our state of Kansas has been working on. And they've actually partnered with a third party to assist with testing. And so there's a website that's been set up, gogettested.com, that you can go out to, that you can identify where there are testing locations throughout the state of Kansas. As you can see from this map here, there's a lot of areas that don't necessarily have access to testing within a given driving distance. And so that's one of the items I know that our state is looking at as to how they can partner with other groups, whether it's be hospitals or other types of entities, to be able to move forward to make sure that people get tested. A couple of the items that we've kind of ran into related to testing is to make sure that once you do get tested, it's very important that those test results are available back to that individual within a timely amount of time, so that if, for example, we saw early on in the testing capabilities that it was taking somewhere between 7 to 10 days sometimes for test results to get turned around. And at that point in time, earlier on in the pandemic, we were asking people that once you got tested, please stay quarantined. Don't go and be among the general public. Wait for your test results. Well, that's very difficult when you're anticipating that it may take 7 to 10 days for testing to get lab results to get back. And so one of the items that we've seen here recently is that it's really whittled down to where it's now between 48 hours and no more than 72 hours to get some of the testing results. However, the next phase that we're looking at that we're really trying to integrate between these testing locations is that typically what happens is that you have the general public that goes to these testing sites, and then the general public receives the results back directly from the testing locations. Well, that's a little bit of a challenge sometimes. If, for example, that local hospital needs to have some type of information to be able to identify whether or not that patient tested positive. And so that's created one of the items that we're really working through in Kansas as to how do we make sure that the testing results that are going out to the general population is somehow getting incorporated into their electronic health record. And it is something that we're focused on. On the next slide, we're talking more specifically about one of the campaigns that we're doing. And one of the individuals in our office, Cindy Samuelson, who's one of our senior VPs, has really been focused on how do we partner with other entities and other organizations to really spread the message of taking the appropriate mitigation steps to prevent the spread of the COVID-19 pandemic. And I know Herb's going to talk here in a second about some of the public awareness campaign activities that they did. We're very appreciative that early on, MHA actually reached out to KHA to see if we would want to partner on this public awareness campaign in the Kansas City metropolitan area. And so through their leadership, KHA did join with MHA for the KC metro area. But what we also wanted to do was to focus on outstate Kansas areas. And so one of the things that we did within our state was really try to find what is that right partnership to really try to educate folks on the steps that are needed for mitigation efforts. And what we did in the outstate areas, outside of the Kansas City metropolitan area, is that we partnered with the Kansas Medical Society, which is our physician partners here in the state of Kansas. We also partnered with the Kansas Chamber, which is the business organization that represents the businesses within the state of Kansas. And we also partnered with the Kansas Farm Bureau because we knew in many cases that it was more of the rural areas that we were having some challenges with the mitigation and the stop the spread activities. And so from that partnership, we did do a number of different publications, whether that's television, radio, digital ads, that really talked about wearing a mask, washing your hands, keeping a safe distance, and avoid large gatherings. And so I do think that that's something that has paid dividends. What we're looking at now is to how do we take some of that momentum with these partners and move that into the vaccine distribution, going back to what Herb mentioned with some of the skepticism related to receiving the vaccine. Can we partner with other groups as they've done in Missouri on really trying to educate the public on the importance of getting vaccinated? I think, Herb, the next slide talks a little bit more specifically about your public awareness campaign in the state of Missouri.
Yeah, thanks, Chad. And so this was just a little bit of our public awareness, and Chad's absolutely right. The thing about the public awareness is how do we continue to talk to the community about mitigation efforts? And sadly, as everybody knows, this whole issue of not only wearing masks, social distancing, and now vaccination have become very polarized politically. And in some people's minds, they've become very authoritarian. And so these public awareness efforts were to put together unique coalitions. Chad talked about his, ours included the Missouri Bankers Chamber, also the Farm Bureau, the Cooperative Extension Service, and many others, to have some conversations across the state with both digital, TV, radio, and other ways to talk about the appeal to folks about community, the appeal to really support efforts to drive the mitigation, and that hope was on the way, and hope was in the area of vaccine, and that if we can hold on just for a little bit longer, we could get through this. So hopefully these kind of public awareness campaigns that you've seen on the mitigation efforts, you'll start to see launched very soon in terms of the need for vaccination. So next slide. And Chad, you want to talk a little bit about this legislation?
Yeah, sure. Thanks, Herb. And just wanted to kind of highlight a few things that was part of the COVID-4 package that passed at the end of December. We've already talked a little bit about some of the direct payments for most Americans, which, currently what was going out was $600. I know under the next package that President-elect Biden is talking about is an additional $1,400 in direct payments for Americans as well. But it is part of that package that passed at the end of December. There's also some additional funding for the Paycheck Protection Program, additional funding as it relates to testing and contact tracing, vaccine distribution, some additional funding related to that. And then going back to the comments that I made earlier related to the Provider Relief Fund, there was $3 billion in additional funding that was provided as well. Before we jump on to the next slide, Herb, any reaction, feedback on this slide?
No, I think you covered it well. Thank you.
Okay, and then Dave, on the next slide, it kind of extends as an extension of some of the items that was included in that COVID-19 package. One item that I think was well received from our membership was the 2% Medicare sequestration holiday that was put in place through now March. In addition, delaying for 3 years the disproportionate share hospital cuts as mandated by the ACA. We've talked a little bit about the surprise medical bills earlier on. And then one area that we were really excited about that was included as part of this COVID-4 package really dealt with Medicare payment models for rural hospitals. And what is included as part of that legislation is this rural emergency hospital program that would start in 2023. And more specifically, this would focus on those hospitals that have less than 50 beds that are either a critical access hospital currently or just a rural hospital. And this is a program or an idea or a concept that KHA has been working on for several years now as to, for some of our rural communities, are there other types of rural health delivery models that we may want to be looking at? More specifically, there's been discussions in some of our communities as to, do we focus more on outpatient services or those other types of ancillary services and less on acute care overnight services? And so one of the items that's included as part of this COVID-19 package was this rural emergency hospital program that we're going to be taking a look at to see what are the details. And hopefully this is something that our state may engage and be an option for some of our rural communities to participate in, to ensure that we have adequate quality healthcare services in some of our rural areas. Any comments, Herb, from your perspective on this before we move on to the next one?
You covered it very well. Why don't you wrap us up with the next one, Chad?
Okay. Last but not least, there's been a lot of activities going on as we've been talking about, whether we're looking at, the COVID-19 pandemic, whether we're looking at some of the changes in the administration, But among all of that, there is some language that required hospitals starting on January 1st, 2021, to make public a yearly list of the hospital standard charges for items and services provided by the hospital. This went into effect earlier this month, and is something that I think has really not garnered as much attention as what we thought it would be, but it is something that we're paying very close attention to. There's still conversations on the federal level as to whether or not the Biden administration may make some changes to this, but it is something that I think from our perspective that is an item that not only do we see there's public interest in, but there's also state interest in as well. And so I do anticipate that may be something we'll be looking at on the state of Kansas.
So Dave, this is the point where we ran a little over from our initial agenda by about 20 minutes, so apologize for that. But did you want to take a quick break, or did you want us to continue forward?
I tell you what, I think in the interest of time, let's just pause for 2 minutes, and that'll help us a little bit get back on track. So those of you that are with us, we're going to pause just briefly for 2 minutes. So it looks like I have 12:06 Central Time. So we'll start again at 12:08. And as you're, kind of pausing to take a break, just so you know, if there are questions and time permitting, there is the Q&A panel to kind of minimize the noise, since I know we have a lot of people working from home and that sort of thing, so we don't hear dogs barking and all that stuff. We will not enable audio for any of our attendees, but you're welcome to use that Q&A panel, and we'll relay those to our presenters. So we'll start back up here in about 2 minutes.
Okay, I see mine says 12:09, so I think we gave him an extra minute, right, Dave?
Yeah, that's right. Go ahead, and whenever you gentlemen are ready, feel free to take it away again. Thank you.
Chad, it's all yours.
All right. Well, and I may jump in, Herb. There's a couple questions already that maybe you and I can kind of tackle. I know one's more specific to Kansas as it relates to, system issues in Topeka, which are slowing down vaccine distribution in Kansas. And one of the items I would just mention is that I know as we've been talking with Secretary Lee Norman, as well as a few other individuals, is that, from their perspective, as quickly as vaccines are coming into the state, they are diverting them to the appropriate locations, whether it's hospitals, long-term care, or FQHCs. I do know that one of the items that has been really pushing them on has been more on the communication side, making sure that we know more specifically as to when those vaccines are going to be available so that hospitals can be prepared and determine how can hospitals serve a role in the local community as we start vaccinating people that are non-healthcare workers in the general community. I'm looking at the next question was more specifically related to how are hospitals that are on the border handling who they get doses from? Is there a concern that areas that have shared populations like that may lack enough to vaccinate the public if they are between states? And I know from my understanding, and Herb, you may be able to elaborate a little bit more on this, but I know obviously if vaccines are being distributed to hospitals in the Kansas City area that are on the Kansas side, those vaccines have to be distributed to individuals on the Kansas side. They could be Missouri residents coming over to Kansas, but they have to be, those vaccines have to stay within the state of Kansas. And I believe the same may be true for Missouri, where there could potentially be Kansas residents going to Missouri hospitals potentially to get vaccinated. But Herb, I don't know if you have any more information on that to share.
No, I think that's accurate on our side, as I understand it, and same for people who are crossing the border. So at least on the 1A for Missouri, if you were a hospital employee in Missouri, but you lived in Kansas, that was fine. They didn't draw that distinction. So there will be people moving across the border to get vaccines, depending on where clinics, where they sign up, where they go to their healthcare provider. That should not be a problem. But in terms of redistribution of vaccines across the border, I don't think that's going to be permissible yet, but who knows? When this thing opens up and we really need to move towards mass vaccination, we'll see if there's any changes in that.
And then there's one other question, maybe just to kind of answer before we jump on. There's a question about having 50 US senators and only that are Republican and 48 US senators that are Democrats and then 2 independents. And how is that a 50-50 split? And that's in essence that the 2 independent senators do caucus with the Democrats. And so I believe that's how they are defining that in terms of having the 50-50 split. Is that your understanding as well, Herb?
That's absolutely correct. They do caucus with the Democrats, so that creates the 50-50 split. And the vice president is the one that breaks the tie. She's on the Democratic Party, and so that's where the leadership will go.
Right. All right. Well, Dave, we'll move on and talk a little bit more specifically about what's happening in Kansas. And I thought this slide here that is the results of some surveys that were conducted back in the fall of 2020 gives a little bit of a landscape as to where, the general populace is as it pertains to their impression for the state of Kansas. And as you can see on the screen here, 56% of the respondents did indicate that Kansas was a very good or excellent place to live. In addition, looking at whether or not Kansas is on the right track or the wrong track, 69% of the respondents felt that Kansas was on the right track, but this was down from 77% from last year that indicated this. And so quite candidly, there's a little bit of a diverse population within our state in terms of where things are going, but wanted to just kind of level set related to that. Dave, on the next slide, just wanted to kind of give a little bit of information related to some of our political leaders that we have in Kansas. Governor Laura Kelly is starting her 3rd year as the governor for the state of Kansas. However, we do have a new lieutenant governor that is just now taking office, and that's Lieutenant Governor David Tolan. David Tolan has been serving as the Secretary of Commerce for the last couple of years, but will be now serving as Lieutenant Governor as our previous Lieutenant Governor, Lynn Rogers, is now going to become the Kansas State Treasurer. And so we are seeing some different leadership changes on the executive branch. As it relates to the legislature in Kansas on the next slide, we have a breakout in terms of the Kansas Senate and the Kansas House members in terms of who are the leadership positions being held by. On the Kansas House, all of those individuals are the same leaders that we've seen over the last 2 years. So Speaker Ron Reichman is now serving an unprecedented 3rd term as a Kansas Speaker of the House. Representative Dan Hawkins is serving his 2nd term as Majority Leader, and then Representative Tom Sawyer is serving his 2nd term as Minority Leader. Where we are seeing quite a bit of change is in the Kansas Senate, where we do have a new Senate President with Ty Masterson. We also have a new Senate Majority Leader, Gene Suellentrop, and then we also have a new Senate Minority Leader with Senator Dinah Sykes from the Overland Park area. What's really fascinating to kind of look at it on this is that quite candidly, all 6 of these individuals currently reside in urban areas, where Senator Ty Masterson's in Andover, which is right outside of Wichita. Gene Selentrop is from Wichita. Dinah Sykes, as I mentioned, is from Johnson County. Ron Reichman's from Johnson County. Dan Hawkins is from Wichita, and Tom Sawyer's from Wichita. And so it is fascinating to see that this is the first time in quite some time, from my perspective, that there's leadership that is mainly from more of the urban settings. On the next slide, we talk a little bit more specifically about the breakout of the Kansas legislature. And in the Kansas Senate, we have 29 Republicans and 11 Democrats. And in the Kansas House, we have 86 Republicans and 39 Democrats. Why that is important is that if you have a 2/3 majority in each chamber, you can override a governor's veto. And by the numbers that are listed on here in both the Kansas Senate and the Kansas House, the Republicans in the state legislature do have a 2/3 majority. And so that does become a factor as the governor starts focusing on some of these policy issues as to whether or not she would be able to sustain a veto of policy issues that maybe she doesn't necessarily agree with. On the next slide, we talk more specifically about our state agency. And we not only has Secretary Lee Norman been serving as KDHE secretary for the last 2 years, we now have a new Medicaid director, and that's Sarah Fertig, who has just started that post in the last couple months as the Kansas Medicaid director. And so someone that quite candidly is familiar with Kansas, familiar with healthcare. She has worked in the Attorney General's office focusing on Medicaid fraud in the past. And so will be someone who I believe will serve well in this position. But it's also of note that typically, for one reason or another, the Medicaid director position does turn over quite a bit. And I think just over the last few years, we've had roughly, I believe, 5 Medicaid directors in the last 5 years. And so it is not a position that for one reason or another seems to have a long-lasting positions in. On the next slide, I wanted just to kind of identify a few of the legislative issues that are being focused on in our state legislature as we move forward. And so this year, just like last year, is unprecedented in terms of everything is really dependent upon COVID. The legislature started coming back into session last week on January 11th. We're now in our second week of the legislative session, and already there's concerns related to not only the protests that's potentially could be happening across the country and in Washington, D.C., but also COVID spread within our state legislature. And so already in our state capitol, they are encouraging some of our state senators not to come into the state capitol today, and they're taking a pro forma day tomorrow, as well as the Kansas House. And so we won't be having legislative business in the state capitol tomorrow. But we do see that COVID-19 response legislation is being highly debated and is a topic of discussion. More specifically, our emergency declaration ends later this month. That was passed earlier last year by the 2020 Kansas legislature. That means that the 2021 legislature has to take action to extend that emergency declaration. All signs point that the legislature will approve an extension to that. What we're looking at probably is just an extension, possibly only until March, but that could be extended longer depending on some of the negotiations that happen between the Kansas Senate and the Kansas House. We talked about on the COVID activities, telemedicine is another big topic of discussion, and that again is highlighting the areas within Kansas as more and more hospitals and healthcare providers are relying on telemedicine, and the public is becoming more comfortable with telemedicine. And so there's going to be discussions related to telemedicine this upcoming year. CanCare expansion, I talked about specifically what may be happening on the federal level, but that's another topic of discussion that we know that CanCare expansion or Medicaid expansion is a priority for Governor Laura Kelly. She mentioned it last week in her State of the State address. And so it is something that will be top of mind for her and for some of our elected officials as they continue through the legislative session. But we also know that it's going to face some tough challenges because the legislative leadership historically in both the House and the Senate have not been supportive of expansion efforts. And what we know is that if you have legislative leadership that's not supportive of certain policy issues, it is much more difficult to get those policy issues through the legislative process. And so that will be a challenge that we'll be looking at as we move forward through that. A couple other items just to kind of share with you: behavioral health care, obviously from outside of COVID, but even now amidst COVID is a topic of discussion that we'll be focusing on. Medical marijuana And I know there's several states surrounding Kansas, including Missouri, Oklahoma, and Colorado, have medical marijuana policies on their state statutes. This is something that we do not at this point in time have anything on the books that allows that in the state of Kansas, but I do anticipate that that will get some discussion and debate in our state legislature during the 2021 session as well. And so this is just a handful of different items that we do anticipate will be coming up. On the next slide, Dave, is more of an outline of one of the pamphlets that we do send out to our elected officials as well as to our hospitals. On the KHA team, Tara Mays is our Vice President of State Legislative Relations, and Audrey Dunkel is our Vice President for Government Relations that oversees not only some of our state activities, but our federal activities. But this document really does identify some of those key items that we're focused on, whether it's non-economic damages cap, of making sure that we protect that within our state. We're looking at behavioral health. On the next slide, Dave, we talk about a few other topics, including the COVID-19 response, telemedicine access, the hospital provider assessment, CAN-CARE expansion, as well as rural healthcare. I know are key items that we're focusing on for the 2021 legislative session. The last slide that I just wanted to kind of highlight, Dave, if you move on to that, is more specifically focused on the economic impact of healthcare within the state of Kansas. And this is something that we have done for several years now in terms of having Kansas State University do an analysis as to what is the impact of healthcare and hospitals in the state of Kansas. And more specifically, as you can see on this screen, that hospitals generally employ around 100,000 people, or 5% of all the job holders in the state of Kansas. And the economic impact that has is that there's a multiplier effect that for every one job in a hospital setting, it creates 0.96 jobs in other business and industry sectors. And so the 100,000 jobs that we have in our hospitals create another roughly 100,000 jobs throughout the entire state and other businesses. And so I do think that that's something that, at least for our state, is an important factor as we talk with our elected officials, because not only are we hospitals the healthcare anchor in many of our communities across the state, but we're also the economic anchor in many regards as well when you look at many of our rural areas. So that's just in a nutshell some of the topics that we'll be focusing on in the state of Kansas. And I'll toss it over to Herb to talk a little bit more about what's happening in Missouri, and then we can open it up for any questions that people may have.
Thanks, Chad. And Dave, next slide, please. So here's a little bit of the agenda we anticipate seeing in Missouri this coming year. In Missouri, similar to Kansas, we have supermajorities in both our House and Senate, so it makes veto overrides rather an interesting exercise. But unlike Kansas, we have kind of a GOP sweep in terms of state elected offices. We have a Republican governor, so that tension, we don't see that as much as there as before. The other thing in Missouri is that we have term limits. Term limits in that there's 8 years or 4 terms for House members and 8 years or two terms for the Senate, for senators. And so that means the leadership turns over rather regularly. So as in previous years, we're going to have a new Speaker of the House and a new Senate Pro Tem. That changes and keeps the dynamics in Missouri rather interesting. So if you look at the agenda that we have here, it's kind of loaded up into 5 buckets. The big one is transforming healthcare, and the big part of that will be Medicaid expansion. A lot of Medicaid payment reform discussions, issues dealing with boarding of hospital patients and IMD waiver, deal with behavioral health. We have our FRA, which is our Medicaid provider tax issue. A lot of activity in protecting public health and safety, dealing with continued response to COVID-19 pandemic, but also the prescription drug monitoring program. Missouri continues to be the only state without a PDMP. So our ability to really deal with the opioid crisis has been hindered in the state of Missouri because of the lack of that information that's been available to clinicians and others in our state. Lots of issues dealing with workforce, including interstate medical licensure compact for physicians. We have it for all other clinicians except physicians. Advanced practice nurses trying to expand their practice will be an issue. And then certificate of needs. So a pretty good agenda going into this legislative session. Next slide. So on Medicaid expansion, let me just do 2 quick slides here and then we'll wrap it up. But we should begin in earnest on this issue next week with implementation. Now, we had a very strong vote in August last year in the primary, where a majority of the citizens decided to put Medicaid expansion on the ballot and pass it. And we did it a little bit differently. We just didn't change the law. We changed the Constitution. So Medicaid expansion is embedded in our state's Constitution in the state of Missouri. And so this year will be the effort to implement this issue going forward. But we have a short time. Governor's State of the State address will be next week. Following that, we'll go to work in earnest on this issue, but by, again, our Constitution, the State General Assembly here must adjourn by the 15th of May. So let me just talk about a couple of barriers and some opportunities out there. So next slide, please. So some of the barriers out there is we have a lot of conservative folks who continue to oppose expansion. And in all likelihood, we'll see a lot of issues dealing with things related to worker requirements and a lot of personal responsibilities. So more of that to come. Some uncertainty about state revenues fueled by the pandemic. But the governor just released here in the last month a number of withholds. So the state economy does appear to be doing a little bit better than what we thought. A lot of disbelief and a concern about cost projections. We think the cost projections are solid. Others are disagreeing with those, and that could be a challenge. There will be an effort to pit groups against one another. They will say anything to deal with Medicaid expansion hurts education. Education funding will go down. We don't believe that's the case, but that will be an ongoing issue for us. There is an issue in Idaho. They were one of the states that also expanded Medicaid by their ballot in 2018. They just came back with some new cost projections that were much larger. But the important thing was in their initial cost projection, it was an oversight. They left out a number of healthcare services out of there. So the cost of the program was far less than actuality. And so they're dealing with some of those issues out there. And then finally, we have a bit of a barrier with one of our HIEs in the state who have erected some barriers towards payment reform. So we'll hopefully overcome that one as well. Next slide. So the key messages for the campaign and what really carried us last year as we move forward was that it brings our tax dollars home, nearly $2 billion a year, protects thousands of frontline healthcare jobs, supports and stabilizes rural hospitals in a significant way, and it supports healthcare coverage for at least 230,000 people, adults single adults that would get insurance coverage. But additional issues have started to emerge as we've looked at this. It will help accelerate Medicaid payment reform because it puts more resources in the program. It is really needed to help stabilize as we continue to respond to the COVID pandemic. I talked earlier about the vaccine and the durability of the vaccine. COVID-19 is going to be with us forever. And so we need a good, stable healthcare system to continue to deal with that. And then it will create jobs. Chad was talking about the multiplier effect that from the K-State study in Kansas. We've done similar studies here in Missouri, and it is powerful, and it will be important. Watch for some additional news on this next week. As I said, the governor will come out with his state of the state. Also, as I talked about the polling that we did on vaccination effort, we've also done some new polling on Medicaid expansion and hope to be able to share some of that publicly next week. But it's clear that there's continues to be very strong support for Medicaid expansion in the state of Missouri, and that's good news. So next slide, Dave. And with that, I think Chad and I are ready to take any additional questions that folks might want to include in the chat, or I guess Dave, if they want to chime in, it's up to you. How do you want to quarterback this?
All right. Thank you both, gentlemen. Hats off to both of you. You had a ton of content and we landed exactly on time. So fantastic work. You guys shared a lot of information. So again, if you have questions, please type that into the Q&A panel. And we'll get those relayed over to our subject matter experts here. We have one in right now. Since HIMSS members tend to be data geeks, yes, many of us are, could you please discuss what efforts the hospital associations are making to facilitate the collection of social determinants of health information to inform healthcare policy?
Sure, good question. So one of the things that we did about 3 or 4 years ago is we produced a report, and I think it was one of the first in the nation, where we began to look at ICD-10 data, our codes. And as folks remember, in 2015, we migrated from the old I-9 to the I-10 system, and we went to a gazillion codes. But in that code set, there's about 100 that deal with SDOH issues that were out there. And so we tried to really look at not only how hospitals in Missouri were beginning to code in that area, but what's the predictive capability of that coding, and in terms of helping us understand where certain issues are, help us deal with discharge planning more effectively, different things like that. So we issued a report on that, and it was pretty interesting. In fact, the folks at the Department of Health and Human Services in Washington liked it enough that they invited us to come in at one of the major conferences in DC and present this information on one of their panels that are out there. So it was kind of a landmark, important piece out of that. But what it did is that it moved us then down the continuum to do a couple things. One is to begin a better education effort with hospitals across the state to use those codes more effectively, because we thought they were so powerful in predictors, and they could be an important tool in terms of future payment, in terms of risk adjustment, things that are out there. And then the other thing that you're going to see here pretty soon on that is something that we're going to launch early next month. Is some of that information will help us begin to deal with some pilots we're going to launch across the state dealing with trauma-informed care. So that too will be helpful for us as we move forward. We're looking at other opportunities with some other folks out there, but I think it's really helped us think about the power of that information and what it can mean. A couple of additional other kind of sidelights from the SDOH issue is that every 3 years, as folks might know, hospitals have to file a community benefit report and kind of tell what they're doing out there. That 3-year cycle, I think, comes up this year. And so hopefully some of this new information on SDOH will help populate those reports and help us do kind of deeper dives of what we can be doing in the communities to reach out to some of these areas, because of people who look at SDOH will tell you your zip code is a better predictor of your health status than actually your actual health. And so powerful information. I'm excited about using it, and I'm glad to hear that question. It's a good topic. It's a good subject.
Yeah, just from my perspective, just to kind of tag on to what Herb mentioned, this is something that we've been paying a little bit more attention to here over the last couple of years. More specifically, last year, we did an analysis on a zip code ranking in terms of some of these measures as well. And so that was the first attempt that we had in terms of trying to publicize some of the impact of the social determinants of health aspects on various populations, as well as across the state of Kansas. And so it's a document I think that we're looking at replicating again this year as we go through the process. And so really important to be able to start better understanding kind of those needs within communities across the state.
All right. Thank you, gentlemen. I haven't seen much information about the actual efficacy of the COVID vaccine and the potential of contracting COVID post-vaccination. Is this by choice to improve the vaccine adoption rates?
Interesting question. I have not seen that either. The only evidence and the information I've seen is the 95% effective rates in terms of immunity, which, as I mentioned earlier, is just off the charts that's out there. I think part of the issue is that people are going to have to deal with is, remember, it's a 2-shot regimen. The first shot gives you about 50% immunity. The second vaccination really kind of finishes the course. And I think a lot of maybe that research that we might see in the future might be looking at those that just successfully completed the 1 shot and those that moved and achieved full immunity. The other thing that's interesting to think through on that is to make sure that we have plenty of time for the antibodies to develop within each of us that get vaccinated. Because after you go through the process, some people might think that they can be, get close to exposure rather quickly. But it'll take some time on that too. Everything I've seen is 10 to 15 days, but hopefully more information on that will be forthcoming.
One of the items I would mention, Herb, I know you guys have a great website as well, is that as our clinical folks here at the Kansas Hospital Association have been coming across studies and different aspects related to the efficacy of the vaccine, we've been posting some of that information on our KHA website. We have a dedicated website specifically on COVID-19 to be able to cover a number of different topics and areas, whether we're talking about testing, whether we're talking about vaccines, whether we're talking about the provider relief funds. So I would encourage you to go out and take a look at our website as well to see what is the most recent information, because we're posting content on a daily basis, trying to keep everyone up to speed as to what we're coming across.
Great. Thank you both. I know as a data geek that spent a lot of time looking at this data, I know another thing that's, impossible for us to measure, but, we've mentioned the 95% efficacy, which is fantastic. When they looked at the Pfizer study, one thing that came out of that was a very large percentage of that 5% contracted an incredibly mild case. Now, what hasn't been easy to measure is, of that 5% that got a mild case, how many of them would have got a more severe case had they not got the vaccine? So things like that is very difficult to measure in the control group that us data people tend to really struggle with. So,
an interesting thought, just an observation about the data, and something I'd call your attention to is a blog one of our research analysts put up last week, where we really started mining the data. So, again, I talked about the fact that as Missouri moves to that 1B population, that's 2.5 million people. That is a huge swath of the state to cover really quickly. But we know that there are certain individuals that would probably benefit better from the vaccination early than others. And how can data lead us down that path to really target those populations? And so that's what that blog looks at. And as I mentioned, our first vaccination in the state of Missouri was on December 1. But then it goes through and says, and looks at 100% of the hospital claims data for the last couple of years, and begins to look at those individuals that had contact with the hospital systems across the state, number of comorbidities that they had, put those together, and basically found that through some good targeting, both in terms of geomapping and data analysis, we could really aid the state and other vaccinators of where really the high impact areas, either by zip code or individuals, where we could reach out to get the maximum effort in terms of the early effort on the impact of the vaccination effort. So I think as we go out here in the weeks ahead and we look at this monumental task of what we have to do, I think there's a real opportunity for data to really provide the roadmap of how we can get the highest impact and really drive this vaccination effort forward. And I would commend this blog, because I think folks that really traffic daily in the data world, I think it gives a good indication of just the beginnings of thinking about how powerful this could be and how much it could support the vaccination efforts.
great. Thank you. Okay. Are the hospital associations encouraging facilities to collect, digitize, and share advanced care plans specific to COVID-19 treatment?
I know we have received some, but I would have to go back and visit with our clinical staff to see whether or not we're receiving all advanced care plans from our hospitals. I think it's more on a case-by-case basis that we've had some that have provided us some examples that we put on our website, but I don't believe we're collecting all from all hospitals in Kansas.
And I think we're likewise here in Missouri on that. What we have collected a lot, and we've partnered with the state, is a lot of the utilization, a lot of the data out there. And early on in the process, we've put up a series of dashboards, interactive dashboards, to help people kind of follow what was going on in the state, and hope to be part of the effort that as we get into the vaccination effort on the dashboards, the vaccination efforts. So that's really where a large part of our data efforts have been to date in this area.
Great, thank you. Okay, Herb, I think this one is going to be pointed towards you. Why is Missouri the only one to not have the prescription drug monitoring specific to the privacy concerns that have been talked about? It's not really valid as the other 49 states have moved forward with this.
It's a good question, and it's something that started in our state Senate years ago by one particular senator who also happened to be a physician, opposed the effort of a PDMP. And largely it was based on his concerns that it would, there was privacy issues related to that. And as a result, we're able to stop that issue year after year in the state of Missouri. And then ultimately, he has now turned out, has gone. But the stake in the ground that he played out as part of that continues to reverberate each and every year in the Missouri General Assembly. And so what we did as an alternative is St. Louis County, on its own volition, started kind of launching its own PD&P, and then began to spread that out to other counties across the state, which we fully supported, to the point where we have kind of a voluntary one now. And it covers probably about 85% of the clinicians in the state. And geography wise, it's spotty, particularly in the rural areas, but it was the best substitute that we could have to be able to try to piece something together that's out there. But largely it's been, as I mentioned, it's some concerns that I think have been allayed with good information over privacy. Haven't been able to get over that barrier yet.
Great, thank you. Also, we've had a request. In fact, Herb, if you could provide this to me, we can send that out in our post-event information. But for the blog you mentioned earlier, some of our attendees would like to see that blog. So if you'd be so inclined to share that with me, I'll get it out in our post-event information.
Dave, I'll send that to you. Happy to do it.
Great, thank you. Okay, if there's any other questions, go ahead and get those submitted, but we've pretty well addressed what we've got out here that's applicable to our topic. So I'll hold on just a minute here and see if we get anything else. But otherwise, again, just a thank you to our presenters, gentlemen. Thank you both for taking time out of your incredibly busy schedules to step in and share with us. Again, this is one of our events that we really enjoy every year, kind of getting that landscape. And again, very critical this year as we're less than 24 hours away from a change of national administration here. So the times ahead will certainly be very interesting. And I know, like most of our attendees, like many, I'm going into a meeting right after this where they're dying to hear what was shared today. So very, very useful, and of course, very, very relevant and timely to everything that we're doing. And lastly, on behalf of HIMSS, I want to thank not only our presenters, but each and every one of you that's still with us today. We all play a critical role in healthcare, and these again are unprecedented times. I feel like I overused that word in the last 10 months, but it could not ring more true. Me having been in this space for 20 years, I've never seen anything like it. Many of you have been doing this longer than me. Same thing. I know some of us are clinical in nature and maintain clinical credentials, but then a large majority of us are not. We are those people behind the scenes pulling the levers, either from a legislative standpoint or from a technology standpoint, policy, best practices, that sort of thing. We all play a role. And, I can't thank everybody enough for their role in this. I had no less than a dozen messages today from people saying that they could not join the session, wanting to know if it would be recorded. Because what are they doing? They're supporting vaccine efforts. So no better work right now. So again, thank you everybody for all that you do, and stay safe out there. We're starting to see some promising times, and it's because of the work that everybody's doing. So it's good stuff. I'm starting to see that on the horizon. So I don't have any more questions in the panel. So if there's any other closing comments from our presenters, we'll close with that.
Dave, just pleasure to be with all of you today. And like you, everybody stay safe, and whatever we can all do collectively to support the vaccination effort, that's where the hope is. That's how we're going to get through this. That's how we're going to bring our economy back and keep our communities safe. So thank you all for those of you that are participating in that effort. It's going to make a difference.
I would just say ditto. Thanks again for the opportunity to visit with everyone and let us know how we can help.
All right. Thank you all. Like I said, we'll get this recording out. So if you had to show up late or if you had to leave early, that'll be made available to you. And Herb's going to send me that blog he referenced. I'll get that in our communication as well. So again, thank you, everybody. Don't forget to complete the follow-up survey for us. 3 questions, really brief. And then also visit our website where we'll be posting our upcoming events. So thank you all. Have a fantastic afternoon.
Thanks.